All right, we're going to look at Chapter 52, Assessment of the Gastrointestinal System. This chapter kind of is going to correlate with Content Section 3 and 4, but we'd like to give you a basic of that because you're going to need to know some of these things when we talk about different diagnostic exams, different assessments for the rest of the three content sections. So the first part, looking at our assessments, is our gastrointestinal system. What is it? So it extends from our mouth all the way to the anus. So it's a very, very long system. There's different structures and functions. Our GI tract, there's 4 layers that are covered in the GI tract. So your first one is your mucosa. That's the most inner layer of your GI tract. So a lot of times whenever we see ulcers or medications, it's really affecting that most inner layer, that mucosa. Then our next is our submucosa, muscularis, and serosa. Function of the GI tract. Its first function, it's secretion. Whenever we take food in, we swallow in our stomach, that makes our stomach release hydrochloric acid. And what hydrochloric acid does is it breaks down food particles into a more simpler form so that it can be processed throughout the rest of the GI tract. So that's a big component of our GI tract is that hydrochloric acid. And we'll talk about different disorders later on, how too much can be harmful for a patient or too less can be harmful for a patient as well. So we need the right balance of hydrochloric acid in the stomach. Another function of the GI tract is digestion. Whenever a patient takes in food and swallows it, the body has to digest it. And again, that's kind of part of where that hydrochloric acid comes in to help break down that food into more smaller, simpler complexes for the body to absorb. And what we do during absorption, it's moving the food or moving the particles, the nutrients, the vitamins that we have taken in, and moves it to the rest of the circulatory system so that other cells can have that. So it knows where to send them. Your circulatory system helps aid those vitamins to get to where they need with the cells. Another function of your GI tract is motility, which makes sense. Whenever we're eating, the food goes down our esophagus into the stomach, and then from there it helps propel. So our GI system kind of has those peristaltic waves that we've learned about, and it helps mobilize, make that food, those particles, have motility to move it to where it needs to go. Then our last one is elimination. Of course, that's whenever all the particles that are not needed, that we've broken down, that's not needed through the GI tract, and it's excreted through the anus in a form of a bowel movement. Some different parts of the GI tract. Our first one is our oral cavity. By the mouth includes the buccal mucosa, your lips, your tongue, your palate, teeth, glands. Mastication is kind of what occurs in the oral cavity, and of course that's just chewing our food. Also, whenever we're chewing our food, as soon as we have taken in food, our saliva helps to break down and soften that food. And one response that's secreted is salivary amylase, and that helps break down carbohydrates. I know you probably learned that in anatomy, but that one specifically is for carbohydrates to help break that down. Our next component is the esophagus. Its function is to help move food from the pharynx to the stomach. There is 2 sphincters that are correlated with the esophagus. We have our upper esophageal sphincter, the UES, and when at rest, whenever we're not eating or swallowing, that UES is closed to help not allow air into the esophagus during respiration. So normally that UES is closed only whenever we're swallowing food to go into the stomach. Then we have the LES, lower esophageal sphincter, and when at rest, it's normally closed to prevent reflux of particles back into the esophagus. So whenever we swallow food, the UES opens, allows the food to go down the esophagus, and then the LES opens to allow food to go into the stomach. And then they both close after we have swallowed the food. Again, the LES is really important when we talk about GERD, because if that muscle sphincter becomes lazy, it allows particles, food to reflux back into the esophagus. So both of those two sphincters are very important when we talk about digestion and absorption through the GI tract. Next we have the stomach. It's located on your left upper quadrant. There's 4 atomic regions. When we look at our stomach, the top part is the cardia. Kind of the base, it goes down from the cardia, it goes down to the fundus. And then the base of the stomach is the body, we call it. That's kind of like the bigger curvature type portion of the stomach. And then your last part is the atrium, which actually goes right into the pyloric sphincter. In our stomach, we have parietal cells. These line the stomach and help secrete the hydrochloric acid. So it's really important to understand, know that term, parietal cells. We'll talk about that more in chapters 54 and 55 and 56. These help, again, secrete hydrochloric acid. And they also produce intrinsic factor, and that's something that we need for to help prevent pernicious anemia. Whenever we do not have that intrinsic factor, we're not able to absorb vitamin B12. So and with that we can get pernicious anemia. So it's very important that patients have that intrinsic factor. Patients that don't have intrinsic factor, usually they have to get vitamin B12 shots monthly. So it's a very important process in our stomach, the function of that. Next, we look at our pancreas. It has an exocrine and endocrine glands functions. Pancreas is actually kind of a unique organ because of that. It has functions that function within the pancreas, and then also exocrine, meaning functions that are on the outside of the pancreas as well. Listed here is the liver and gallbladder. Here is some functions of that. It does storage, protection, metabolism. It's a very, very large organ. Your liver and your gallbladder are both located on your right upper quadrants. They also help with secreting bile. Kind of gives what the stool gives its brown color. We also have our small intestine. It's probably the longest portion of your digestive tract. It's measured 16 to 19 feet, so it's a very long in length. But if you look at the small bowel, it's very kind of condensed, compacted in, so it's very curved around each other. We have the duodenum, the jejunum, and the ileum. Those are your components of your small intestine. The function of your small intestines help with movement. So again, it helps that motility to move things down to the large intestine. It also is for digestion, and also it's for absorption. It's one of the major organs of your absorption of the digestive system. A lot of electrolytes, water takes place, the absorption takes place in your small intestines. Then lastly, we have our large intestine. There is 4 components of that. Your first part of your large intestine is ascending. Then you have the transverse, you have descending, and then you have your sigmoid. And what's kind of important about where they get their names from, ascending is kind of on your right lower quadrant. Your transverse is kind of exactly midline. So it goes kind of vertical with the body. Then you have descending and your sigmoid, which is located on your left lower quadrant of your abdomen. And again, its purpose is movement. We're moving things through the large intestine. So we're moving it to the rectum into the anus for elimination. We also there is some absorption still that takes place in our large intestine, but again, most of our absorption takes place in the small intestine. And also, then we have elimination. This is again where the stool has been moved to the rectum into the anus and then moved outside of the body. So before we move on to our physical assessment, I do want you to look at your gastrointestinal changes associated with aging. We will look at those for each assessment. So I do want you to look at your chart 52-1 on page 1080. What I want you to really look at is the stomach. With the elderly or the older adult, we see a decreased hydrochloric acid level because they also decrease absorption of iron and vitamin B12. And this can cause gastritis in a patient. So some interventions we do for these patients: make sure they eat a bland food, things that aren't very spicy. That's going to really affect the stomach. They're not going to have that hydrochloric acid to help break that down. So it can put them at higher risk for developing gastritis and also ulcers eventually as well. So I just want you to look at that chart 52-1. Make sure you look over the physiological changes related to aging, and especially the stomach. I really want you to know that they have decreased hydrochloric acid levels.